Good morning and welcome to our very special November Coffee Hour event. For those of you who don't know me, my name is Agnieszka Carpenter and I'm the Executive Director of BioMe. BioMe is also known as Bioscience Association of Maine. We're a trade industry group and our mission is to advance bioscience in the state of Maine. If you attended any of our previous coffee hours, you know that we usually have about 3 or 4 guests who talk about the research that's being done in Maine, the new and existing companies and entrepreneurs. But today we only have one guest, Dr. Nirav Shah, who is coming to us in the midst of a surge of COVID-19 pandemic. So we are especially grateful for his time and accepting our invitation to speak. Before I introduce Dr. Shah, just a couple of housekeeping items. Today's event is a Zoom webinar, which means we don't see you and we can't hear you, but we know you're there. And I'd like to thank everyone for joining us on this Friday morning. Dr. Shah will start by just giving a short presentation, and then we will move to the Q&A session. I have some of the questions submitted before, but feel free to leave your questions either in the Q&A tab or in the chat function. Both of them are on. And without further ado, the man who knows it all. He holds an MD and a JD from the University of Chicago. He studied economics at the University of Oxford. He has a fan club of 30,000 on Facebook. His face is on a bar of chocolate. He was recently featured in Scientific American and appeared on Good Morning America. He's often praised for his impeccable style of communication. And when talking about the pandemic, he uses analogies of glitter, Swiss cheese. He quotes songs, everybody loves him, and we couldn't be more excited and honored to host him at our event today. It is my great pleasure to introduce the director of the Maine Center for Disease Control and Prevention, Dr. Nirav Shah.
Well, thank you. That's so generous of you, Agnieszka. I'm really delighted to be with everybody, and thank you for the invitation to join. And really, I appreciate so many folks tuning in. It's well over 180. So very, very excited to chat with everybody and take your questions and hear what's on your mind. What I thought would be the most useful is for me to just spend a few minutes providing an overview and potentially teeing up some deeper and more deeper issues and items for discussion. And so I'll provide just some snapshots of where things stand. But please, I really feel like the best thing I can do today is to answer the toughest questions that you might have about where we are, what we're doing, potentially even where we may be going. So please don't hesitate in tossing your most pressing questions over, and we'll try to get through as many as possible if that sounds good to everybody. So let's start with where we are and then talk a little bit about where we might be going. Where we are right now, both nationwide and in the state of Maine with respect to the pandemic, is very, very alarming. Right now in the state, we've got just over 7,200 cases, but by the end of today, I expect that number will be around 7,400 or so, maybe even 7,500. 2 weeks ago, we were experiencing something on the order of 30 to 40 new cases per day. Now we are regularly seeing 150, even upwards, maybe even 175 cases per day. Adjusted for our population, that still puts us in very good stead relative to other states. But based on where we are and the low numbers that we've seen up until now, that increase is very, very alarming and is almost the textbook definition of exponential growth. It could be logarithmic, it could be any of the other curves, it could be sigmoidal, there's all sorts of ways to describe it. But what we know for sure is that it is a rapid expansion of cases just in the past 2 weeks. Maine is not alone in experiencing that. I don't know if it makes it better or worse, but we're not alone. States across the Northeast, indeed across the country, are experiencing the same rapid expansion. Indeed, right now, there is not a single state in the country where the net number of new cases over a single incubation period is going down. Every single state is going up. There are some reasons for that, and we can discuss what some of those may be, some of which are behavioral, some of which are driven potentially by climatic and environmental factors, we can discuss that a bit more. I will say that a lot of what we know about the rapid expansion of cases is partly in keeping with what we see traditionally with respiratory viruses as the weather cools. Query whether there's something unique happening with respect to COVID-19 and SARS-CoV-2, something we can talk about. But the other things that I think are happening alongside of not just the number of cases, we're also seeing some unfortunate and deeply alarming shifts with respect to the metrics that we use to keep tabs on the virus in Maine. The two that I'll just spotlight really quickly, one is the positivity rate. We monitor both the daily positivity rate, but there's less information there. The thing that we really take a look at is the 7-day weighted average positivity rate. And that too in Maine has increased very, very significantly. To put that in perspective, right now, that number stands at 1.5%. Still one of the lowest in the country, to be sure, but triple what it was just 2 weeks ago. We haven't seen a positivity rate of around 1.5% since early July. Now, for scientific clarity, I think it's important to note that the denominator in early July looked much different, both in size and composition, than it does now. The volume of testing, which is the other metric I wanted to mention, which is just the number of PCR tests per every 100,000 people, that has expanded very significantly. Right now, it stands at 590 PCR tests per every 100,000, puts us in very good stead relative to the burden of disease we've got. 590, if you compare that to where things stood in July, it was around 150. So about a fourfold expansion in the volume of testing that is done across the state. And thus why those changes in the positivity rate are arguably even more concerning. We're doing fourfold the amount of testing, roughly speaking, and we're seeing a tripling of the positivity rate. In addition, the composition of who is being tested now is much different than it was in the summer. So all of those signs point to, again, very rapid expansion of disease. The other thing I'll just mention from an epidemiological perspective is that what we are seeing now is a rise in cases that is not being driven by focal outbreaks, but rather widespread dispersed community transmission across the entire state. In July, much of the daily numbers of new cases were accounted for by outbreaks, be that in long-term care facilities, hospitals, et cetera. Now what we are seeing is basically the vast majority of new daily cases right now being driven by community level transmission in all 16 counties in Maine. That's concerning in and of itself from a disease control perspective, because there are things that we can do rapidly in outbreaks. We can close down a meat processing facility, so on and so forth. But when you're dealing with community transmission, that's very difficult. The other reason that shift in the past 12 days to community transmission is deeply concerning is that today's community transmission can very easily become tomorrow's outbreaks in long-term care facilities. So we're kind of looking at a pendulum that is starting to swing, and we're hoping that it doesn't tip over and generate outbreaks in places like long-term care, meatpacking facilities, other tight congregate care, congregate living settings. So that's where we are. Unfortunately, that is grim, but that is where we stand. So what's going on the horizon? Well, given the composition of folks today, the one thing I wanted to take a second to chat about is vaccines. There are a number of vaccines in the various stages of testing right now. I'm not going to go through all of them. They are in different phases of their various clinical trials with respect to enrollment. None of the vaccine manufacturers has, as of yesterday, submitted any sort of emergency use authorization application to the FDA, but we understand that such applications could be in the works for as soon as this month or next month. From what I am told, the first such application, and this is not secretive information, this is information that I've been privy to learn from public briefings. Among the first vaccines will likely be the first vaccines to seek authorization. I have no idea what FDA will do with that application, but among the first will be that's being created by Pfizer. which is an mRNA vaccine, a 2-dose mRNA vaccine. If that application is the first to be sought, it may be the first to be authorized, in which case that would be the first vaccine to be rolled out. Another vaccine that is also in the various stages of its trials is that by Moderna, also an mRNA vaccine. There are subsequently other vaccines that are being studied, one being developed jointly by Oxford University and AstraZeneca, relies on an adenovirus vector, and then another by Janssen and J&J, which is a little bit further behind. Both of those, as many may know, were put on pause because of some cases, at least in the AstraZeneca one, a single case of transverse myelitis. It was later found that the transverse myelitis was not thought to be related to the vaccine, and thus the trial was allowed to resume. Our plan for rolling out a vaccine is largely in keeping with that the National Academy of Science and the US CDC have recommended or conceived of. That is to say, starting in various phases, focusing initially on frontline healthcare workers, whom we know will be needed to expand our overall vaccination force, and then moving on secondarily or in parallel to individuals who live in congregate living settings, like long-term care facilities. Moving from there, thinking about individuals who are at serious risk for complications from COVID-19 because of their baseline health status. Sadly, in Maine, that encompasses a high number of people. And then working through a system that expands the reach of the vaccine from the most vulnerable groups, so on and so forth down the line. This will undoubtedly be one of the largest and most significant logistics ventures that the entire country, the entire public health system has undertaken in at least a decade, if not longer. The same applies for the state of Maine. There are significant questions on the horizon, both from a tactical logistics perspective. For example, the Pfizer vaccine requires ultra cold storage on the order of -80. How we accommodate and pre-position the vaccine so that not a single dose is wasted, that's a logistics challenge. There are also really difficult technical and ethical questions. What if the first vaccine that is approved is not the most efficacious? And the early data suggests that the second vaccine may in fact be far more efficacious. Do we wait? Do we move forward with what we've got? Given that our system relies on vaccinating those who are the most at risk first, is it ethical to give them a vaccine that may not be the most efficacious one? These are really, really difficult questions, both again, tactical as well as ethical, as we think through any type of rollout of the vaccine. So with that, I'm going to pause, and Agnieszka, I will let you take us through the questions as you see fit.
Absolutely. Thank you so much, Dr. Shah. It's definitely going to be difficult, but I think we're in good hands, Dr. Shah. That's just my comment. The first question I have is from Amy Blakely from Corning, and it's not so much related to the state of things right now, but more related to your experience. What has it been like to go from being the director of the CDC to being the director of the CDC under the eye of the media and world news coverage?
That's a good question. It's something I do think a lot about. Here's what I'll say on a pretty sort of personal note. Although you don't go into public health, I worked in the private sector for many years, and was asked by the former governor of Illinois when I lived in Chicago to serve as the director of the health department in Illinois, which I was honored to do. He lost his re-election bid in 2018. And I loved the job so much that I told my wife that the one thing that I really wanted to do was to do the same job again, but perhaps in another state. That was actually a joke, because it's exceedingly rare for health directors to go from different states to different states, because it's a deeply personal job and you have to have a deep connection with the people you're working with. But I was really lucky to be able to have the opportunity to move to Maine. These are the times that you go into jobs like this. No one ever wishes for there to be a global pandemic. Don't get me wrong. We never wish for that. But the reasons that I left the private sector were for times like this. So this is why government service matters. This is why it's important to have good people in government. And this is why I left the private sector. So is it difficult? Of course. Is it hard being in the spotlight where everybody wants to Monday morning quarterback? Sure. But I stand on my principles. I communicate about what's going on. And thankfully, folks in Maine have responded to what we're doing. So it's hard, but this is why you do the job.
Thank you so much. So do you consider yourself a Mainer?
I do, actually. Part of the reason that my family and I really wanted to move to Maine was the things that we like to do are what people in Maine do. We realized after 2 decades of being in Chicago that, we never got to go skiing, we never got to go hiking, we never got to go outside. And when we had the opportunity to come here, the things that Maine is known for are the things that my family and I love to do. Skiing, hiking, mountain biking, cycling, those are the things that we base our free time on. So I'm really, really, really delighted to be here.
Great, thank you. And so speaking of hiking and skiing and biking, this takes me to our next question, which is about the new executive order regarding the masks outside. And someone in the audience asked about this too, and mentioned hockey on ice. So I think everybody's a little bit confused as to what exactly it means, a public.
Yep. So there's going to be more to come with respect to sports. I think even today we'll be issuing some additional expansions or explanations with respect to organized sports. So I'd urge everyone to hold tight on that piece. But with respect to the face coverings, what Governor Mills did was expand not who should be wearing a face covering, but where face covering should be worn. And going forward, Governor Mills's executive order requires the use of face coverings in any public setting. So if you're on a backcountry hiking trail where there's no one else around, you're not on a public setting at all, then no, a face covering is not something required, because in the executive order, things like hiking trails are not part of the definition of public settings. But if you're walking down the sidewalk in your town or city, that is a public setting. It's a public space, and that is somewhere where a face covering needs to be worn. And I think we can all understand why. There's a chance that you could have an encounter with somebody, given the higher expansions of diseases that we're seeing, where you could potentially transmit, or face coverings are most adept at preventing transmission. So any type of public setting, that's where a face covering needs to be worn.
Thank you so much for that answer. The next question will be a little bit rooted in our own community, because on this call we have a lot of bioscience company employees and scientists. And so the question comes from Toby Aarons from Focus Maine. So you may know that many of the Maine businesses have played an important role in the country's response to the pandemic. So some examples are Abbott, IDEX, Puritan, Jackson Laboratory, and many others. One question that also came from Gary Goodrich asks about the rapid tests by Abbott. Where are they? Are they available in Maine? Where can we get them? But Toby's question was about the opportunities to grow this sector in Maine, and what's your perspective on it, and how has it been to cooperate with the Maine businesses from the CDC perspective?
Wonderful, great questions. I'll start with the former one, which is with respect to the rollout of the Abbott Binax Now rapid antigen test. Maine is slated to receive approximately 400,000 of those tests through the end of this year. And we're going to be distributing them to a variety of different locations: federally qualified health centers, shelters for people experiencing homelessness, so on and so forth. But and then in addition to that, we're working with Walgreens, so that Walgreens can set up and offer the tests on a zero cost basis. Actually, sorry, no, I'm not sure about the pricing. I'll get back to everyone on the pricing. But we're going to be offering them at Walgreens locations in Maine that have drive-throughs for obvious safety reasons. And so that'll be a way that the general public in Maine can also take advantage of these tests. And the test is a very good test, although because of our overall low prevalence rate, the positive predictive value for the test is something that is not ideal. And that's just a function of the test itself. So we're also coupling that with recommendations to make sure that false positives get confirmed, that individuals who are symptomatic and negative potentially also get confirmed. But we're excited to have that test in our arsenal to complement the other testing that's already happening at the nearly 30 or so swab and send sites that are doing PCR-based testing. The other question is what it's been like working with the biosciences community. And it's been outstanding. We've had wonderful success and partnership with the laboratory community, with the research community, with the academic community, partly for sort of development of processes. You mentioned Jackson Laboratories and Puritan to have processes and materials in place, but we've also leaned on them and called upon them just for thought leadership as well. Are we thinking about this the right way? Is there a better way to do the logistics around this? So I've been delighted to have that close partnership and look forward to continuing it on.
Thank you so much. We're very grateful. Another question we have is from Dr. Karen Hausnick from University of New England. And Karen says, early in the pandemic, there were challenges around shortages with PPE, etc. With the recent surge of COVID, where do we in Maine stand now with the availability of the PPE and other critical supplies? You mentioned the negative freezers. There was also a question from Pastor Arnold from New England cluster about those freezers, because maybe he might have access to it. So if you're interested in talking to him, I can connect the two of you later.
That would be great on that connection, because -80 freezers are a difficult commodity to find right now. So that would be much appreciated. To Professor Hausnick's question, the availability of PPE is thankfully a bit more robust than it was back in March. However, and so we have not been made aware of systematic shortages on the part of healthcare providers, first responders in Maine who have requested PPE. For the most part, they make requests of us and we're able to fill most of those orders. However, as we go into a surge, we anticipate that there will be a demand for PPE to rise across the country. We've anticipated that for months. This isn't my first pandemic. And so we have been stockpiling and building up our own supplies of PPE to hopefully be able to withstand that increased demand. We never know. It's difficult to make projections of this nature, but we believe we are well positioned to provide PPE to healthcare providers to keep them safe.
Thank you. We have a couple questions about the wastewater testing. One of them is from Dustin Updake, and he says, monitoring wastewater for COVID seems like a practical, low-cost approach to understand community transmission. The University of Maine this week detected for the first time the virus in wastewater. Could such an approach be expanded across the state? What's your opinion on that?
So yes, it could be, but there are two theoretical conceptual uses for wastewater testing. The first is what was mentioned, which is just understanding the levels of transmission in the community and drawing some degree of correlation between what is found, how much RNA is found in wastewater, and what we know to be community levels of transmission. That's interesting. It's a good idea. It's something that we've done with other infectious diseases and non-infectious diseases. How much it informs our day-to-day practice, it's not clear. We know that community levels of transmission are very, very high. So it could potentially help us to characterize that better, but I'm not sold. The other approach is from a more action-oriented surveillance idea. And there, municipal level wastewater testing tells us a little bit less. That is to say, what are the actions that are taken after it's detected? Now, if it's being done at the level of a dormitory, that's helpful because you can then reflex and test everybody in that dormitory. But if it's being done at the level of an office building, what's the next step? Similarly, if it's being done at the level of the municipality, what's the next step after that? I think that's the difficult question that we all need to answer before we go headlong into wastewater testing. The more contained the location, the easier the next steps are, and the more action that can be taken to stem the spread of disease. The more diffuse the level of testing, the harder those next steps become.
Mm-hmm. Thank you. I see a couple questions about Thanksgiving and students coming home. Either students who are in schools in Maine going to other states, or maybe students who are in other states that have maybe a much higher rate of COVID coming back to Maine. What testing paradigm would you recommend? Do you have any other recommendations about masks? What would you do if you were a student coming home for Thanksgiving?
Yeah, so Thanksgiving is going to pose significant challenges. The baseline requirements for folks who are coming into Maine, be they college students or other family members, is that unless they are arriving from Vermont, New Hampshire, or Massachusetts for the time being, and we're taking a look at what to do with Massachusetts and whether we may tighten the restrictions. Unless they're arriving from one of those three states, they either have to quarantine or get a negative test within 72 hours of their arrival in the state of Maine. And that applies, again, to college students or other visitors that you may have. And that is per the governor's executive order. That's not a recommendation. That's not a best practice. That is the governor's executive order. So now once they arrive, and even if they have tested negative, there's still the possibility of some degree of transmission to them or from them. And so as we go into Thanksgiving, I'm really recommending that even when folks are within their own homes, when you're around others, face coverings are one of the best ways to reduce the likelihood of transmission. It's not easy, it's inconvenient, it's the last thing we want to do. But much of the transmission that we've seen as we've interviewed new cases has been from people who have gathered in small household gatherings. And that is only going to get amplified as we go into Thanksgiving.
Mm-hmm. Thank you so much. I think that's something everybody's wondering about right now. The next question has to do a little bit about our community again. I see it appear twice. One of them is, how did you develop your clear scientific communication skills? That's something you're praised on. Any advice for other scientists? And then I have a related question that's from Jessica Davis-Knowlton from from BBI Solutions. And she says, what advice do you have for biomedical professionals as we speak to the public audiences about science and medicine? Are there any specific tips for reaching out to political leaders?
Okay, good. Let's start with the former. When I was in the private sector, much of what I focused on was appellate argumentation in courts of appeals, and even higher than that. And that's an area where before you go in to argue before a panel of judges, you spend weeks and weeks rehearsing your argument and tackling questions. And that's the same thing I do here. I don't take any public appearance lightly, especially if it's one with the media. We spend hours preparing for each and every single press briefing. If a press briefing is at 2 p.m., from 7 a.m. until 1:59 p.m., we are preparing for it. What's our message? What are we going to say? And how are we going to respond? So the first key is intense preparation with my communications director. But the second is the following. A lot of times in situations like this, when someone asks you a hard question, the tendency is to talk around the question. Let me put it more concretely. If someone asks you what time it is, do not tell them how to build a clock. All too often, especially in technical subjects, when we're being attacked or being asked hard questions, people will say, well, how come you don't know what time it is? And the inclination is to say, well, let me show you how to build a clock. And it doesn't work. The only way to communicate clearly is if someone asks you what time it is, you tell them what time it is, even if it's not the time they want to hear. That is the only way to get any kind of messaging around. Folks know immediately when you are prevaricating or dancing around a question. And no matter if you ultimately end with the truth, they've tuned out. Now, To the latter question about the best ways for scientists to communicate with non-scientists, there is an equivalent tendency to combat fantasy with reality, and it doesn't work. We've all had this experience interacting with people in our lives who don't believe in the fundamentals of science or facts or logic. And all too often, what we do in those situations is to bombard them or inundate them with facts and processes and papers and citations. I don't think in the history of recorded human thought has that approach ever actually changed someone's mind. The best thing to do is to lay out not so much what you're talking about, but why it's important, and always try to tether it to why it should matter to the person who you're talking to. Whether that's through a narrative, whether that is through a personal experience, or whether that's through asking them why they believe what they believe, those are the ways that you can actually start to convince people of the position you're advocating. But the bombardment of facts or the trying to combat fantasy with reality, whether you're talking about vaccine hesitancy, wearing a face covering, it doesn't work. The better question is not so much, to tell people, it's to ask them why they believe what they believe. So whether you're communicating with government officials, members of the media, or people in your own family, that's the best place to start.
I think that's all. Thank you so much.
Yeah, I think I've got time for one more question.
Great, thank you so much. The question is, what is special about Maine? Even though we know we have a surge right now, but the surge is present everywhere, still Maine has a relatively low rate of infection. What has happened in your opinion?
Yeah, I think that's a great question. I think there are some things that do have explanatory power and other explanations that have less power behind them. Well, let's start with some of the ones that do have a little bit more explanatory power. The use of face coverings, at least according to some various studies and surveys that have been put out, there was a very good Washington Post article about a week ago that summarized them. The use of face coverings in Maine is thankfully robust, 80 to 85%, which is quite good. Is it 100%? No. Would we like it to be there? Certainly, but it takes time to get there, and we've got to recognize that. But even based on that, relative to other states where the epidemic is raging much more aggressively, face covering usage in Maine is commensurately higher, and I think that gets us a long way toward the explanation. One of the other explanations that's been touted is the relatively low population density / rurality of Maine. I don't know that that really carries much force. Some, to be sure, some, but the population density of other states that are experiencing much, much more forceful levels of transmission is lower than Maine. Alaska, Wyoming, South Dakota, North Dakota, Montana are just a few that come to mind. So although that does probably have some degree of the explanatory, in the math, and maybe accounts for some percentage, who knows what, I don't think it really stacks up when you take a look at some of the other states. Even states that have a similar geographic composition, 1 or 2 population centers, and then a dispersed population thereafter. I don't think it really holds up. Idaho, I was looking at their data on Wednesday night. Similar type of geographic structure, but significantly higher rates of disease. So to me, I think some of the reasons that Maine has done better has been because of more widespread use of face coverings, coupled with really early aggressive pushes of PPE and widespread adoption and expansion of testing. Those, I think, all taken together lowered our rates quickly and allowed us to go through the summer without any gradual increases. That means we can withstand the exponential, or whatever you want to characterize it, levels of growth that we're seeing now. Basically, when you're dealing with epidemics, the better position you come into a surge with largely predicts your ability to withstand that surge. So we came into it in a better footing than other states did. And I think that explains why, even though we are experiencing high numbers now, it's not as high as what we've seen in some of the states I mentioned.
Thank you so much. I think you also forgot to mention that one of the reasons is that we have a wonderful CDC director, but that's just an opinion of everybody who's on this call today from what I'm seeing in the comments. Thank you so much, Dr. Shah. We appreciate your time.
Thank you.
Thank you. Have a great day.
Thanks, everyone. Have a wonderful time. I look forward to chatting again soon.
Absolutely. Okay, well, Dr. Shah had to leave us. We knew he didn't have much time, and we're actually super grateful that he found the time he found for us this morning. Thank you so much, everybody, for joining us. I hope you enjoyed today's coffee hour. We will have a new coffee hour, December edition, coming soon. I will send you the date pretty soon. Enjoy the rest of your day, and thank you so much again.